But the economic devastation being caused by these lockdowns may be creating a new pandemic, one of mass anxiety and helplessness.
If you feel absolutely normal and not under any kind of stress, anxiety or depression, well done. You may skip this video.
Lockdowns, death, illness and job insecurity all have an impact on how people feel.
If you feel even slightly affected mentally by COVID, make sure you watch this video till the end. I guarantee that you will be in a much better mental state by the end of this video, especially after I narrate a recent experience of mine towards the end. My name is Yash. My goal is to help you level up in life and become a better version of yourself. If that sounds interesting to you, make sure you hit the subscribe button. Let's get started. Something unprecedented has hit us hard. The most basic anxiety is, will my family and I be fine? And it starts playing on your mind because of the data, the news, false narratives and social media. Add to it social distancing, the shortage of necessary resources like oxygen, and uncertainty around whether I will get a bed and treatment on time. The COVID mental health crisis is real. As the COVID-19 pandemic rampages on through much of the civilized world, it's not an overstatement to say that our lives have been turned upside down in the past year. Our mental health during COVID-19 hasn't been good. Our approach to this life-changing year has been interesting, to say the least. As a people, our response has seesawed between the extremes. At times humorously overcautious, at other times embarrassingly naive and inadequate. I have often wondered whether there exists a scientific model to explain the roller coaster of emotions we had experienced during the first wave of the pandemic. Turns out there is. Kubler-Ross theorized that those experiencing grief go through a series of 5 emotions: denial, anger, bargaining, depression, and acceptance, commonly referred to using the acronym DABDA. This is how it fits in the context of COVID mental health. Denial is where it all began. As the whispers of a new respiratory illness in Wuhan grew to a buzz in January 2020, most of us were not concerned. Even as the first cases were reported in the Indian subcontinent, we did not see a cause for alarm. Surely the people in charge would figure it out. Yet, slowly but surely, the cases kept piling up, and it was no longer possible to dwell in denial, and we shifted gears to anger. Much of it was taken out on unscrupulous NRIs who flunked quarantine measures and endangered others. We were angry and we needed someone to crucify. And as the panic truly set in, the bargaining took center stage. Perhaps the virus won't be able to withstand the brutal summer heat. Perhaps a Janta curfew will stop it in its tracks. If I social distance for 2 weeks, everything will be better, right? Everyone, from critical care specialists to chaiwalas, had an opinion, and the banter was deafening. The imposition of strict lockdown measures followed, altering life as we knew it. Bars and restaurants pulled down their shutters and streets lay deserted. It was life unlike anything we had witnessed before. As the novelty wore off and the new normal set in with all its weight, it was hard not to be depressed. Fear had set in as we were surrounded with uncertainty, which brought us to the final stage of our little play: acceptance. Everything wears off, even fear. Most of us had stopped obsessing over the number of cases. The mounting death toll didn't shock us anymore. I was resigned to the fact that despite all the precautions, for most of us it became a case of when, not if. Acceptance, as you might imagine, is where the power lies. We find control in acceptance. I can wash my hands. I can keep a safe distance. I can learn how to work virtually. However, the acceptance phase wore off when the first wave was gone, and we saw hope in the form of vaccines. But then, the unexpected second wave hit us, and it hit us way harder than before. This time, its toll on our mental health became devastating. COVID became a major threat to our mental health. Most of us have never been through a war or a revolution, but this is how it must have felt mentally during those times. There are people waiting, people suffering, desperate for medical aid or help that would be too late, and those sitting at home watching helpless and anxious if they would be next. Those who have been impacted firsthand would not know how to channel their anger and grief towards an invisible enemy. It's not like the virus has feelings, ethics, or is vengeful to destroy selectively. It is a pest without discrimination and without a heart. Maybe that's why it's so powerful. How can humans, delicate and vulnerable, survive such a ruthless terrorist? A terrorist who doesn't negotiate. How is this impacting even the survivors amidst the wreckage? How is COVID affecting our mental health? My family was recently affected by COVID-19. My grandmother even needed a hospital bed. On 1st May, I was finally getting my grandmother discharged from the hospital after over 10 days of struggle and running around to keep her safe. While I was waiting for the formalities to conclude, I saw a man there, desperately chasing a doctor to get answers to his questions. He looked exactly like me from 10 days back. Tired, clueless, and desperate for help. The doctor had no time to answer his questions as he was more concerned about getting to his patients on time. After 10 days of solid struggle and learning, I knew the answer to this man's question. So I reached out to him and told him that I can help. I answered his question, got to know that his name is Pratik and that he has come from another city only to take care of his sister's family. He had more questions. While I didn't have an answer to most of them, I sure did know how he felt at that moment. I understood his pain and I told him that I understand. As I uttered these words, I understand, I could see the relief on his face and hear his voice become calmer. We went on to talk for about 10 minutes where I heard him out and spoke of how this situation is terrible and how COVID has taken a toll on our mental health. When I had to leave, I told him that I really want to help, but I'm not sure I can help with things like obtaining Remdesivir. However, I can be available for him on call for anything that I can help with, from my experience of dealing with the exact same thing for the past 10 days. I could see his face light up as I shared my phone number with him. Just the feeling of having someone to fall back on mentally relieved a ton of pressure off his head. It had been over a week and Pratik hadn't called me. So I called him yesterday to check how things are and if I can help at all. He told me that his brother-in-law is in the ICU and isn't doing too well. We went on to speak for a while and he shared how he's feeling and how he doesn't have much help. Not once did he ask me to help him get any form of physical resources. All he wanted was for me to hear him out. He was very happy that I remembered him and that I called to check on him. He said that talking to me made him feel relieved because that makes him feel like he has a lot of help, even though I might not be actually able to help him with resources like Remdesivir. He told me that just knowing that he can call me if he needs any kind of help takes away a lot of stress and helps his mental health. The point of sharing this story is to show you how little acts of kindness can leave a huge impact on a person's well-being. What did it cost me? Nothing. What did it give me in return? A feeling of happiness and fulfillment. The one you get after doing a very good deed. How do you think it helped Prateek? Let me know in the comments down below. Now that I look back at the struggle I faced on the journey to get my 84-year-old grandmother the treatment that she needed, I realized that there's a lot of people who came forward to help. And whether I took their help or not, just their presence did take a lot of burden off me. At no point did I feel like I was alone. And that is what got me through this tough time with sanity. If you have cared for someone, done as much as you could and felt helpless that you couldn't do more, know that it made a tremendous impact in ways that a thermometer or an oximeter cannot capture. And not just caring directly. If you had shown empathy by expressing gratitude to a frontline worker, made arrangements and inquiries to help someone, contributed to reliefs, created content that lifted someone's spirits, or even thwarted COVID by staying at home, you have made an impact, irrespective of whether it is acknowledged or not. If you feel that a close friend, co-worker, neighbor, relative, or anyone else is silently going through a tough time, talk to them. Share this video with them. Tell this to whoever needs to hear it. Stay close to people who feel like home, who give you hope, the ones who make you feel understood, the ones who offer support and strength to help you fight your battles. We are still fighting a war. We don't need a psychological war, especially within. We will get through this together. We will beat this COVID mental crisis soon. I hope you're leaving this video feeling better. If you like this video, be sure to subscribe and watch some of my other recent videos as well. And let's level up together.